get hemorrhoids.
Absolutely.
Yes. And women get them pre and post pregnancy. Why do you get them during pregnancy, and how do you get them after?
Yeah, so anything that increases pelvic pressure, so having a baby in your uterus, extra pressure in that pelvic region can exacerbate hemorrhoids. Also, constipation is more common during pregnancy, another exacerbating factor. And then there are hormonal changes that kind of change the musculature and the strength of your blood vessels during pregnancy. So there's a lot of different things that can exacerbate hemorrhoids during pregnancy.
Do they naturally go away after birth, or do they become reoccurring incidents?
I have had a number of patients who have told me ever since I had my baby, I've had hemorrhoids ever since then. So it is harder once you've had hemorrhoids for them to go away, especially if they've been exacerbated enough. Going back to your prior question, some people during the delivery process, so a vaginal delivery, pushing, that's a lot of pressure in that area that can also exacerbate hemorrhoids.
What should new moms do to feel better?
So something I did when I had my baby was the moment I got out of that delivery room, I said, give me my stool softener. I want to make sure that the first time I'm going to the bathroom, I am not constipated.
Did you have
a Bristol
four or
Bristol
more?
4.
Even if it's a little bit on the diarrhea side, that's better, because you do not want
break the seal.
Yeah.
Did you have anesthesia? Is that why, or is that common after birth?
I think it's common after birth, and even if you have an epidural, you get certain types of medications. People get anti-nausea medications like Zofran. That is constipating. And you're just afraid in that area, and there's a lot of trauma to that area. It's people on social media talk about that first poop after pregnancy being as traumatic as the birth itself. So
is this where you would recommend having a sitz bath?
A sitz bath can be helpful, and also just giving that area a lot of extra care.
Do you think this is something OBs should be talking about more, and in our mission to normalize conversations like this?
I think OBs can be talking about it. I think other pregnant people can be talking about it. People who have had babies before. I thought about it because of social media. People were commenting about it, and I was like, well, I'm pregnant. I'm a GI doctor. I am not going to let this happen to me.
And so you successfully had a baby recently. Congratulations.
Thank you.
And you did so without experiencing any sort of a hemorrhoid flare-up.
No, I did have a hemorrhoid flare-up, but I did get a stomach bug during my pregnancy.
Got it. So there's extenuating circumstances.
Yes.
And how did you treat your own hemorrhoid flare-up?
So I did the preventative measures that we talked about, staying hydrated. I worked with a pelvic floor physical therapist, and she gave me a great tip, which is lying with your butt above your heart, so on a yoga block with your legs against the wall, and that can help drain the blood vessels back to your heart.
On your stomach or on your back?
On your back. So it's like a yoga pose
where you're bridge pose. Yeah. Supported bridge.
With your legs. Yeah, exactly. Supported bridge pose.
And would that be recommended for anybody?
Yeah.
Because that sounds like not exclusive to...
Nope, not exclusive to pregnant women. So if you're having a hemorrhoid flare-up, I recommend spending 5-10 minutes a day in that pose. That can help relieve the strain on your hemorrhoid. And then using topical therapies for my hemorrhoids. I wish norms had existed back then, because that would have given a very clear pathway of what I should use and when I should use. And I think that's why it's important, because it's overwhelming, and when you're pregnant, it's hard to find the right information out there.
Right.
Yeah, I think the norm system is one of the easiest systems out there to use, of understanding when to wipe, use the cream and spray, and understanding that they're each designed for a certain point in the flare-up.
Exactly.
Do women get hemorrhoids even if they are not pregnant or have never been pregnant?
Absolutely. Similar to men, some of the same exacerbating factors: constipation, sedentary lifestyle. I always tell people to avoid looking at your phone when you're on the toilet, because that increases the amount of time you're on the toilet. So all of those life choices without ever having a baby can exacerbate and lead to hemorrhoids.
Why do you think that in at least popular culture, right, cartoons and movies and TV shows, hemorrhoids are normally associated with men?
I think men are more comfortable in popular culture talking about butt problems and poop. Yes! And, you know, some women are embarrassed to go to the bathroom in front of their partner. They want to pretend that they never poop. Mm-hmm. And so I think that's an extension.
No, I just found out that women poop 3 years ago. Blew my mind.
We do?
Yeah.
We poop.
Yeah. Well, I've come a long way.